Could you discuss what you think are the key treatment implications regarding the risk for malignancies?
The use of antiretroviral therapy has been exceedingly effective in decreasing the risk of AIDS-related malignancies, the classic AIDS-related malignancies, Kaposi sarcoma, lymphoma, and to a lesser extent cervical cancer. In any event, of those three diseases, AIDS-related lymphoma is perhaps less affected by the use of ART. The incidence has clearly gone down in a highly significant way, but not as decreased as the risk of Kaposi sarcoma, for example. If one starts antiretroviral therapy at the beginning of starting that treatment, the risk of the malignancy still is there, simply because the malignant event has occurred prior to the moment that you started ART. So one of the values of antiretroviral therapy is clearly to prevent the occurrence of the classic AIDS-related malignancies. The problem, however, is that in the heart era, we are clearly seeing an increase in the non-AIDS defining malignancies. Those would include Hodgkin's disease, which in fact is a type of lymphoma, very often involving Epstein-Barr virus infection. Another example is anal cancer. An evolving issue right now is HPV-related oral cancers. Still another issue out there in terms of the non-AIDS related cancers is lung cancer. The non-AIDS defining cancers that are increasing are primarily related to viruses which of themselves can cause cancer. Biggest example there is human papillomavirus, HPV, which causes cervical cancer, anal cancer, and newly understood oral cancer or head and neck cancer. The use of vaccines against HPV, especially HPV-16, might be expected to decrease that risk over time. But at this moment, most individuals infected by HIV have also been infected by HPV. And so if we're going to prevent, those will be in much younger people, looking in the future for decreases. Lung cancer is another issue. There is no known organism associated with lung cancer. This is lifestyle related, primarily smoking. And it turns out that HIV-infected individuals are more likely than HIV-negative to smoke. That is a huge risk factor for lung cancer and seems to be even more of a risk factor in the setting of HIV than in HIV-negative patients. So to summarize, in the setting of heart, we are seeing a major decrease in the classic AIDS-related malignancies. First, Kaposi sarcoma. Second, lymphoma. Third, lesser because the cases are just down, cervical cancer. But despite those successes in HIV-infected patients, we are still seeing increases in other kinds of cancers, mostly those related either to lifestyle, i.e. lung cancer, or related to other, quote, oncogenic viruses, such as Epstein-Barr virus in Hodgkin's disease or human papillomavirus in anal, cervical, and head and neck cancer.